Experiences from birth or early childhood can continue to impact the body even decades later if they're left unaddressed. And today I unpack one such experience with my guest and fellow physical therapist, Beth Anne Fisher. Beth Anne was born with three kidneys, and in this fascinating conversation, we discuss Beth Ann's session with me and that helped to reveal the link between her childhood surgery, her current sacroiliac joint pain, and the activation of her nervous system. Together, we uncovered what happens when the organs respond with fear, memory, and intelligence, and how early life experience can live on in the tissues decades later, and why SI joint pain might have nothing to do with SI joint pain at all, and how we used imagination, dialogue, and respect to unlock profound change in this session. And we also talked about what it really means to truly listen instead of impose on the body. So, listen into today's episode to learn how acknowledgement, imagination, and gentle dialogue can create profound shifts without force or coercion. If you're drawn to visceral work, somatic wisdom, and honoring the body's intelligence, then this conversation is for you.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
Hello, everybody, and welcome to this episode. Today I have with us Beth Anne Fisher. Beth Anne is a physical therapist. She has been, how long have you been a PT, Beth Anne?
Oh, over 20 years.
20
Yeah.
years. And
Uh-huh.
you have studied a lot extensively with Baral, the Baral Institute, learning visceral manipulation and all their wonderful courses. And Beth has taken some courses from me, and you are currently practicing in Denver, Colorado. And Beth and I just recently, so Beth took my courses early on when I first started teaching back in 1819, I think, somewhere in there.
2018, I think, is
Yeah,
what I've
yeah,
got. Yeah.
yeah. And then uh and then we haven't seen each other in a really long time. And then just in December, we were both taking Gail Wetzler's pregnancy postpartum course, which really should be fertility, pregnancy, postpartum, baby.
Yeah.
I mean, it was so comprehensive, you guys. I absolutely loved her course. It is, I would say, a more advanced course for
Yeah.
visceral
Agreed.
practitioners. But if you have been in that curriculum, please check that out because it was really, really good information. In fact, you said you had something that really shifted for you during that.
Mm.
Do you want to share
Yeah.
that?
The first day of the course, I had no idea, but you mentioned the fertility piece, and that's always been a strong interest of mine, having trained in mind abdominal therapy and some other things besides. And so I was really struck by the endocrine balancing
Mm-hmm.
and
Yeah.
actually have struggled with menstrual migraines for 4+ years. That's the only time I get them pretty much. And for the first time in 4 years, we're still like jury's out, but I didn't have one last month and haven't had one
Woohoo.
since the class. So I think there might be a few factors in there, but I
Yeah.
strongly suspect that that was one of them.
Yeah.
So really
Well,
fascinating.
yeah, the body is, and that's why we do what we do, isn't it? Because we absolutely love the mystery and
Yeah.
it's a big puzzle to me, and I love puzzles. So,
Yes.
and then Beth actually reached out and got on my schedule because do you want to tell people what were you dealing with and why you chose to come have a session with me?
Yeah, I have some ongoing issues with SI joint pain that pops from side to side at different times. And, usually I do pretty well, but had quite a significant pain response for whatever reason a month and a half ago. And just was trying to work through it with all my tools. And
Hmm.
of course, from hearing you in my head and other folks in the visceral curriculum further on, and having been a pelvic health therapist, I checked my cervix position and it was way off to the right, as right as it could be.
Yes.
And I thought, oh, I can't reach it. There are times as practitioners when we need help from others. And I thought, well, I'm just gonna see if Lynn's schedule has an opening and get her opinion and help on this. So
Yeah.
that's when I came to your office because my cervix was
Way
out of
off to
whack.
that right. Yeah. And have an SI joint issues. I
And the
mean,
SI joint, yeah.
yeah, put two
The
to
connection.
yes.
It's been impressed from, I think, your podcast and your work
Mhm.
very strongly that, and from Brawl, that SI joint issues I have good results in my practice when I work more with uterus, cervix, uterosacral ligaments
Yep.
than
Absolutely.
just the SI joint. So I knew with that connection that I wanted someone to take a look who understands that connection intimately.
Yeah, yeah. So it was such a cool session. And that's why I asked Beth Anne to come on the podcast to share it with us because you also had a very, so as I did my standing assessment and, felt a little twists going on in your body and standing, but I was also really drawn, as I scanned the lower back, I was kind of drawn to the kidney area. And then, then you laid down. And I really got drawn into the left kidney area.
Yeah,
And well, actually, first we got drawn into your heart. This is where we
you're
need to
right.
start,
My
Beth.
heart's beating.
Remember? So,
Yep.
Beth Ann, my hand landed on your heart and your womb, and
Mm.
I could sense that that heart just wasn't settled in your chest area. So I encouraged Beth Ann to check in, and you did, and you were noticing where it was at, but I
Okay.
really got the intuitive hit that it was from your history.
Mhm.
And do you want to share people what happened to you when you were a baby or a toddler, really?
Yeah. Yeah. Well, I was born with three kidneys. And we didn't know that initially. And actually I've learned my mom has three kidneys. So there's this genetic anomaly.
Yeah.
The challenge is that there were two kidneys that were connected by a lobe, so I'm told, on the left side, and each had its own ureter to the bladder. One of those two kidneys was not really functional, and so it was kind of feeding garbage into my bladder. And as an infant, I was getting bladder infections and maybe had a kidney infection as well. The history is a little bit fuzzy, but it
Yeah.
was not good and it needed to come out. So then I was put on antibiotics for over a year
Wow.
until they felt this would be like 1980. So thinking about pediatrics and surgeries in
Yeah.
1980, they at least wanted me to be 2 years old for particular reasons. And so then I had the kidney removed, the extra one on the left.
Yeah. And so when I had my hand on the heart, that surgery, that 2-year-old really popped into my
Yeah.
awareness. And so Beth Ann wasn't tuning into that. And so I just kind of asked her, what does your heart have to
Mm.
think about or feel about that surgery?
Yeah.
And then what do you remember your response?
Yeah. No, I remember. Yes, I remember. The first piece was at that little kid, like not being told, and I was
Oh,
having an image of all these masked people around the table, the operation table, and like not knowing who they were and not having that vagal connection with these people who were opening
yeah.
my body. And it's beautiful the role that imagination can
Mhm.
play in helping us to orient what we're sensing. And so yeah, there was this piece of just feeling really disconnected and feeling like no one told me this was happening. And,
Yeah.
I don't know these people and I don't want to be here. And what's
Yeah.
happening? Yeah.
And so I asked her, I'm like, well, what would that 2-year-old want?
Hmm.
And
Yeah.
would you?
Yeah. And first, she wanted to be told what was happening. She wanted to be with her mom, of course. But then what she really wanted was to like I still have this image clearly in my head that came up while you were working on that area of sitting on a blanket in like a play area with all my surgeons, and they're wearing their scrubs but they don't have masks on, and we're just playing. And they're helping me to warm up to them, and I mean
Mhm.
stuff that wouldn't happen in reality, but I could sense somatically that it
Yeah.
was opening my system. And there was a natural point at which then I found myself on the operating table and feeling this connection with the providers that were taking care of me. Like it just flowed into that place after a few minutes.
And what I noticed in my hand is that your heart just settled
Yeah,
into your chest. Yeah, that happened when you were actually playing with them,
yeah,
in your imagination,
right.
but your heart just totally settled. And then my hands got drawn into your kidneys. So my one hand was underneath your back,
Yep,
and, it was just tuned into both kidneys. And what just noticed right away was that your left kidney was just energetically pulling up towards your head.
yeah,
And I confirmed, I think I knew, like, the left side was where the others, where you had the two kidneys.
yes.
And as I tuned into that kidney, trying to move up towards your head, I really like tuned into what I was noticing and feeling in that kidney. And I
Yeah,
actually started laughing because, do you remember that?
yeah.
I'm
I
like,
was like,
oh, yeah,
what?
right. I know. But it was kind of like the kidney was afraid and it was running away. It thought it was going to get taken too.
Yeah,
And
yeah,
and I was just like, oh my gosh,
yeah.
and so I shared that with you. Well, I
Mhm.
think I tried to have you tune into it first
Yeah, I
because,
was having trouble with that one. There's a lot of material for me around that left kidney, and a lot of work that's been done, and a lot of like I
yeah,
just it was helpful in that moment to have your sense of things because I wasn't able to really like
yeah,
tune in that well to what I
yeah.
felt in
And
that
and
moment.
so then, when I shared that with you, I was like, well, it just feels like this kidney's trying to hide, and like it
Mhm.
it felt like it was going to get taken too.
Yeah.
And then your response, do you remember what you said after that?
Um, I've I'm trying to remember the recall I have right now is there was this pervasive sense that I've had my whole life for a lot of reasons, but I think this is one of them of like waiting for the other shoe to drop. Like when
Ah,
is it my turn? Based on
yeah,
what you were saying, like when are they coming for me? Like
yeah,
when is this kidney, that's going to happen to me too. So
yeah.
that idea of waiting for the other shoe to drop has been a concept I've worked with
I love it.
personally a
Yeah,
lot. And
yeah.
I think there's something tied up in this with that as I've been reflecting since we
Yeah.
worked.
I do remember you
But please,
saying, I do, yes, that was a part of it. And I remember you saying at some point, going, oh, it's missing its buddy.
oh, yeah,
Do you remember
yeah,
that?
I do remember that too.
Yeah. And it was like, oh, like it didn't know, like they were friends, right? They were
Yeah,
connected. And then
right,
all of a sudden it's gone.
right.
And then it's like, well, wait, don't take me too,
Yes,
and so we had to do some dialoguing with the left kidney to help it to understand that, that kidney was actually hurting it,
right.
and then helping it to say goodbye to it and be okay
Mhm.
with it releasing, and then letting it know that it's not going to be taken. And then our next step with that,
Yeah,
and then the kidney did soften and it
yes.
relaxed on
Uh-huh.
the left side. And
Yep,
then we introduced it to the right side. Do you
we
remember
did.
that?
Yes.
And
Yeah, and actually that's come up a lot just as a contemplative moment in life since we met. Just you guys are kind of nurturing
yeah,
the awareness of the connection between the two, but
yeah.
that maybe is a few steps ahead. Yeah.
No, no, no. That's where
Yeah.
we're headed.
Yeah.
But that's, that when we have paired organs, and I learned this from Tammy Lynn Kent and her to
Mm.
work with the ovaries.
Yeah.
And we can apply that to any paired organ in our body.
Mm.
And that's where we went was, we first checked in with, well, does the left side even know there's a right side? And I don't
Right.
think it did
I don't
it?
think it did either.
Yeah,
Yeah.
yeah. And so then we kind of got them connecting and checking each other out,
Yeah.
and that was just so beautiful. I don't know what you felt in your body, but in my hand there was just kind of this like, oh, they both kind of like just settled in
Yeah.
together.
Yeah.
So
Yeah.
your mid back.
That's congruent with my experience too. There was kind of some softening and almost actually what I was feeling was a lot of tingling under like good, pleasant
Mhm.
tingling under your where your left hand was as we were kind of helping this dialogue to unfold. And that tingling spread um, kind of across the spine at that
Mhm.
level of the kidneys and then spread to the right side. And I can't
Mm.
remember if your hand was going with it or not, but even so, it was just a really interesting kind of like connection creation between
Yeah.
those two. And that's what I was feeling. That was kind of fascinating.
Yeah,
Yeah.
it's so, God, I love the
I
body.
know. It's
Thank you so much
cool.
for sharing this
Yeah.
this because it was the coolest session.
Yeah.
Okay, so then, we got your kidneys nice and happy.
Yeah.
And then it was like, okay, we're done here. And then I went down into your pelvis.
Hmm.
And and I don't remember much externally. If you do, help me out. Like I don't think there was that significant of a difference in your joint mobility, left side to right side in
No,
the
I
SI
don't think
joint,
so.
right? No.
Yeah.
Um,
Yeah, because it's been shifty anyway. It'll be
yeah,
right, left, and yeah,
yeah.
I
Um, and we checked in with the uterus, and I think there was a little bit of tension in the uterus
yeah.
externally. Do you remember? I don't
The
remember
fundus, I
fully.
think you felt was also off to the right.
Yeah. Okay. Yep. Yeah. And
Yeah,
it was restricted. So it didn't
yeah,
have, so like
restricted to the
right,
right.
broad, right uterosacral. So I think I did do an external
Mhm.
uterosacral ligament release on the right side.
Yeah,
And that kind of helps soften the fundus a little bit more. And then
right.
we went internally.
Yeah.
And internally, we found the cervix way off to the right hand side. And you've also, I hope you don't mind me sharing this, you've also had tension in the pelvic floor. So insertion has always been challenging
Mhm.
for you.
Yeah,
And I remember like I could only get one finger in.
yeah.
And so I was doing what I could with the one finger, and there
Mhm.
was a beautiful softening. I did the internal uterosacral releases, and uh, there was a nice actual softening of your pelvic floor muscles.
Yeah, both
Like,
sides, which was
yes,
because that left side is usually the one that's impacted with the dyspareunia. So
yeah,
yeah,
yeah, yeah,
uh,
yeah. Okay.
thank you.
So both sides of the muscles just really just melted. And then I actually was able to get two fingers in,
Yep.
and just worked on helping that cervix to have a little bit more mobility in there.
Yeah.
And it's been, I don't know how old you are, but I would
Mhm.
imagine, and have you
I'm
rechecked it
I'm
since then?
47. It's
You're
fine.
47, okay. But like how long has that cervix been over there was my point with this, like who
Yeah.
knows? And have you checked it since? Do you know? Is it still
Um,
did it go back or has it
I
stayed?
actually I haven't checked it yet. I
Okay.
was kind of
Yeah.
wanting to give it some time. It feels like, I
It,
mean, stay tuned. It feels like it's in a better place. My SI joints have been amazing since I saw
great.
like I
Great.
actually, I was like, do I or don't I? I did go for a little run with the dog that afternoon, felt really, really good.
Awesome.
I was able to go to my strength class, felt really good.
Good.
It's been good since I
Great.
saw you, which is
Now,
pretty cool.
yeah, I think it's important because I
Mm.
know from my own personal experience, I had an issue with my right SI joint.
Yeah,
And I went to a practitioner who knows how to scan the body and work in the way that I do. She's worked with
sure.
me and she studied with me, but it was my left kidney. And my left
Okay.
kidney was causing right SI joint pain.
Your
But it
left
was,
kidney.
yeah, yeah.
Oh, okay.
But what the point I'm making is
Yeah.
that, hey guys, if we have SI joint instability, check out those kidneys. I
Yep.
don't know exactly, mine wasn't structural at all.
Sure.
Like there was no physical issue going on, but we did a visualization and I worked with what showed
Mm.
up in my kidney.
Yeah.
And after releasing that, my SI joint pain went away.
I
So
I'm a believer. I get
right?
that.
Yeah, I guess so. I just want to make that point, everybody. Like,
Yeah.
if you've worked with the SI joint and you've worked with everything else and you're still having instabilities there, please check out those kidneys.
Yes,
You know?
totally.
Yeah.
I and
So,
I was feeling as before I was able to connect with you and I was really kind of investigating the pain with curiosity that I suspected the kidneys were playing a role.
Oh, interesting.
So it's fun to actually hear you share your experience
Yeah.
because I'm like, yeah, these things are, I mean, we know about the fascial connections. It was interesting to get more into the emotional connections a little
Mhm.
bit though too with the session that we did.
Yeah.
And just like the interplay between the two or lack thereof that may be contributing
Yeah. Do you mean
to the two
the
kidneys
two kidneys?
the two
Yeah.
kidneys and then
Yeah.
how that impacts because even in speaking right now and listening to you're helping this to unfold, it would be one SI joint or the other, it would be one kidney or the other.
Mm,
And if there's not a lot of cross communication between the two,
yeah.
somehow in my mind that makes a lot of sense that it's not just one side, it's going back and forth in my experience because these kidneys are like talking to everybody except each other.
Yeah, right.
Yeah,
Well, we also, and I teach, and I know Burrell teaches as well. If the kidneys aren't happy, the psoas muscles aren't happy. Like if the kidneys toast,
yeah,
which means they slide down,
right,
they come inferior, they will activate the psoas muscles.
right.
And
And that
so
was definitely happening for me.
okay.
Yeah.
Well, and what's funny with that, Beth Ann, is that uh I didn't really manipulate the kidneys in this session. You
Yeah.
know, it was just tuning into them. And I think that's the biggest piece that I want everybody listening into this podcast to understand is listening to the energy
Mhm.
of the organs, of the extremities, of the tissues. And it's
Yeah.
like, what do the tissues want to do? That's the question we need to be asking as we put our
Mhm.
hands on people's bodies. And that when you learn to tune into the energetic response of the tissues, they guide you.
Right. They do.
And then there's no guessing. It tells you, and I was like, oh, there's something going on. Like it was so loud in my hand. It's like, wow, that's really pulling up towards your head. And then as I got curious, I go, wonder why. And then I like tune in. I'm like, oh, it's trying to run away.
Mhm.
It doesn't want to be taken either. Like,
Yes.
yeah. Oh,
Yeah.
if only surgeons understood the consciousness of our tissues and our
Right.
organs and what they're doing. And, I it would be a different outcome in surgeries for sure.
Agreed.
Yeah,
Yeah.
yeah,
Sure.
awesome. So,
Yeah.
Beth Ann, tell us a little bit about your experience, if you don't
Mhm.
mind, with the visceral work that you've done, the
Mhm.
stuff that you've learned from me. How has that impacted your practice and work with your clients?
Yeah. Honestly, doing your class back in 2018 like was my introduction to any kind of visceral work.
Oh, okay.
I had studied with Tammy Kent.
Uh-huh.
And then I had gone and done my abdominal work, and that's visceral in its own right, but it's not so osteopathic per se
Yeah.
as some of the things that Brawl teaches. So then I took your class, and of course, I my mind was blown about letting tissues lead. You know, I've been a PT a long time, and I actually spent 15 years in ICU, which is a whole other animal.
Wow.
But we tend to learn to be directive with our patients, meaning telling them what to do.
Yeah.
And I was kind of over that at the point that I started connecting with your work and like, well, if the body can tell us what to do, I'd rather do that.
Yes.
I just didn't know that was possible, having come from a different background. And so 2018 on, then I started working with Brawl because, of course, I wanted to learn what you were teaching and I wanted to take it to another level and really get into the anatomy and really get into the dynamics of what's
Mhm.
happening because I'm quite the learner. And
Yeah.
so that filled in some of the curious whys and
Mhm.
gaps in knowledge that I had, and I continue to flesh that out. But to be really honest, Lynn, I use your work all the time.
Oh,
Your way of assessing the pelvic bones is for me like if I don't know where to start or my listening takes me somewhere funny or whatever, like check the pelvic bones first, see what's happening there. It's a great starting point, and honestly, it's often a great finishing point. I know there are
yeah.
sequences and things, but sometimes the body has its own way of
Yep.
sequencing things. But I really, really learned how alive bone is from your
Ah,
work. And
Yes.
I certainly have some really cool stories, even in the recent year, that I've been really dedicated to some of the bra work in the practice that I'm working in right now with my colleague, um, leaning into and kind of summoning is the wrong word, but summoning kind of you in the space of being with some of these women postpartum who are many years postpartum and seeing me
Mhm.
for other things, but then like coming back to their first birth being really traumatic and not even doing much except holding containment for those bones or noticing the hardness, right? You
Yeah.
talk about that so much, and then listening for what that bone wants to do, and it bones really do soften. It's very
Yes.
cool.
Yes. I know. I'm
The muscles
addicted to
soften
that.
too. Yeah. Yeah. And the other thing I think that was really helpful for me was when you talk about the hierarchy. It was
Mm,
the first time I had heard about like the hierarchy as far as the nerve, and you can fill in if I'm saying this wrong, but
yeah.
as far as the nervous system is concerned, like the hierarchy of protection, well, the muscles are at the very bottom. So
Yeah.
I'm always telling patients now, like, hey, muscles are usually protecting something else. They only do what they're told. So while we can work with muscles, and it's not bad to work with muscles, it's generally not the place to start.
Right.
And even in my session with you, remembering that I was having a lot of psoas or hip flexor issues
Mm.
along with that, we didn't work on that. And I'm always trying to tell patients that too, like, hey, if it's the psoas, it's probably something else that we need to do.
Yes.
So there
Yeah.
were so many starting points to my shift into this work that I owe a lot of credit to you
Um,
kind of helping me land those things for the first time. And
right.
they've just continued to be true as I've
Yeah.
continued to work with more bodies.
Oh, that's so great. Thank you, Beth
Yeah.
Ann. I really
Yeah.
appreciate that. Yeah, it's such beautiful work. The body is absolutely amazing, and I think the more that we can listen to it and just tune into it, the greater the results that we get with
Yeah.
the people on our table.
Hmm.
And that's, I'm so honored to be a part of being able to help people to shift to this new way of working with the body that
Yeah.
I find is a lot more respectful. Um,
Agreed. Yeah.
and yeah, and I love how much you have gone on and taken it and, study the Burrell curriculum, everybody is just incredible.
Mm.
And I have to say, I felt a little, um, not out of water, but at Gail's course, I
Mm.
just don't work in
Hmm.
that way,
Yeah.
um, and so I feel Boral's work is very specific, very, you gotta
Precise.
find precise. That's the exact word. Yes,
Yeah.
Beth Ann.
Yeah.
It's very precise. And
Yeah.
I am not a precise therapist. I'll say I'm more of a general globalist, or
Sure.
global.
Yeah.
And and so I work with the tissues in the way that resonates and works best for me.
Hmm.
And then if I'm not getting to the root cause or something's still up, I have my people that I can refer to that are more precise with that.
Sure.
And so
Yeah.
I share that in giving people permission to
Yes.
work in the way that works best for you. Honor
Yeah.
yourself. And that's why I'm okay for those people that don't get me, don't, want to go down
Totally.
this path, right? We all have
Yeah.
our way of working with the body, people, and it's all perfect. So
Mhm.
do you and
Do
do what
you?
feels right for you,
Yeah.
and if this resonates with you, I'd love to share what I know about working with the body. So, Beth Ann, thank you so much. Is there anything else you want to share before we say goodbye?
I don't think so. Just thank you for the opportunity to share. And it was kind of nice to reflect together on
Yeah,
the arc of our path crossing and recrossing, and
yeah,
just being able to geek out a little bit about
right?
all the things we're learning and how bodies are really cool. And
Yeah.
you make a huge contribution to in my world, and I know many others because I've talked to other people who've done your courses, and it's beautiful work, and I'm grateful, very much so. Yeah,
Thank you. Thank you, Beth
yeah,
Anne. I'm so grateful to you too. And thank you for coming on here and sharing your
hmm,
experience with us.
sure,
It was such a fun, cool session.
it
So
was.
grateful. And your back's doing good now, right?
Yeah, it's doing good. There's a little piece that kind of we're back to that's a lot more tolerable. That's kind of
Yeah,
around the pelvis, but it's a different thing, and it's it's an opportunity for continued exploration. But I'm back to all my things and
great.
working through it. So yeah, it's I'm
Awesome.
very grateful. Yeah,
Yeah, thank you. Well, it's always a journey, right? There's always
it is.
layers.
Yeah, there
We
are
all know,
layers, and that's
right?
okay. It's learning
Yeah.
to be okay sometimes with the layers too. So
Yeah, yeah,
yeah,
awesome. Well, I'm so grateful to you for coming on and sharing your experience. Hopefully, those listening in have taken some golden nuggets from this,
yeah,
and I just hope that we've expanded some minds here with these ideas. So,
I hope so too.
yeah, thank you everybody for listening in. Here is to smoother births, faster recoveries, and to listening to the body and enjoying the wonder that the mystery that the body holds for us. So thank you everybody. We'll see y'all on the next episode. Take care. Bye-bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.